Welcome back. Now we're going to get into the fun stuff of actually applying the electrical stimulation to our patient. So we're going to simulate and say that we have a patient who comes in, they've been having some knee pain, and so we want to go with a simple application of IFC, or interferential current. Okay, IFC, again, you'll kind of learn this, or you will learn this in lecture, but essentially we're just going to make sure that those currents are crossed, and so that we get some sort of interference between the two, and that's where our treatment is really going to take effect or take place. So we've got our patient, we get them in the appropriate position, a comfortable position. In this case, just long sitting with a couple pillows behind them on the plinth. They can lean up against the wall, and most people are pretty comfortable like that. If they want to go and lie down supine on their back, we can elevate the legs a little bit, whatever the patient kind of wants. And again, just make sure that they're comfortable, because they are going to be in that position for usually a minimum of 8 minutes, so we can bill, right? And get paid for it, but upwards of 15, 20, or even depending on if we're doing some neuromuscular education, it can be upwards of 30, possibly even 40 minutes, kind of depending on the application or the setting that we're using, or the reason we're using the electrotherapy. So keep that in mind as far as patient comfort goes. Make sure that they're going to be able to be comfortable in that position for the entire length or time of the treatment session. Okay, this one, again, it's preset for 20 minutes. If I don't feel like we need to go that long, then we can go 15 minutes, and again, the patient usually for 15-20 minutes is pretty okay for something simple as this, sitting in that long sitting position. Okay, so I would first, before I apply anything, again, I've turned on my machine, I've selected my machine, I know what settings I'm going to use. I've chosen IFC, so it's IFC. I'm going to go high frequency. So really, I'm not doing much as far as changing my actual settings for the machine. The changes that I'll make are when I start to look at changing that intensity, which we'll talk about here in a little bit. But one thing that you want to make sure that you do before applying any modality to your patient is check for and ask about contraindications or precautions. Okay, again, I won't really get too much into what those are, what those aren't in this video, because you know that NACIS will be talking about those in lecture, and then we'll have other opportunities to talk about them in other labs and whatnot. So I will say that I've done that. No contraindications, no precautions. We're good to go. Patient doesn't have any issues. And so, again, I get them into that correct position. When you guys do come on or into lab, we'll actually have a few handouts. This is just the lab handout, but we'll have a couple different handouts for you guys. This one's application technique, just to kind of give you some guidance as far as what you need to be looking for, what you need to be asking about, and thinking about before and even during the application of the electrical stimulation. So again, asking about contraindications or precautions, choosing the proper machine, making sure the settings are correct, checking your lead wires, making sure that you don't have any frayed wires or anything like that, so that everything runs properly and we don't end up injuring the patient. Choose the correct electrodes. So these are the electrodes. Again, if you've had electrical stimulation, you're probably familiar with these. You guys will actually be each getting your own set of large electrodes as well as small electrodes. So the large ones are approximately 2 by 4, and then the small ones are 2 by 2 inches. Depending on the area, the size of the area that we want to treat. So the first the patient that the first patient we're going to talk about is that knee patient, and so I'm going to actually use the large pads because it is kind of a larger area. Now, if I was going to be treating the ankle or some smaller area, then obviously the smaller pads would be a better idea. Okay, so I've chosen my machine, I've chosen my pads, I've done everything that I need to do as far as making sure that we're good to go with the patient. get them in the correct position, and then I'm going to look at getting it actually applied to the patient, start turning up that intensity, okay? So let's get our patient in the proper position. We'll have him swing his legs. He's our videographer as well. There are his sexy legs. Okay, I've got a wet towel here. Some people say that you should use like alcohol wipes or anything like that, which you can. One issue that I have seen, and maybe this is just primarily because I've worked with geriatrics more than anything, is that if you wipe them down with alcohol, their skin gets really dry. And you can end up getting some cracked skin and some kind of skin flakes that will stick to the pads themselves. So I typically go with just some water, a wet rag or anything like that. Wipe it down, get rid of any excess lotion or body oils or anything like that. Does pretty darn good. I haven't had any issues. So I'm going to treat this area. I'll just come through, slowly wipe down that area, make sure that it's nice and clean. I'll go a little bit larger than the area that I know I want to treat, just to make sure that I'm not going to end up putting a pad on a place that isn't clean. Okay, so I'm nice and clean there. I've wiped down. We're good to go. I grab my pads. For IFC, again, you'll learn this in lecture, but for IFC, we want to cross those pads. And so I'm going to make kind of a figure four, or not a figure four, excuse me. I'm going to set each of them up and kind of make a square with the 4 pads. Put one there. You want to avoid bony prominences as much as possible. Sometimes you can't completely, but try and avoid it as much as possible just because it can increase the intensity of what the patient is feeling. So there's my setup as far as pads go. And what I'm going to be doing is between these 2 pads, I'm going to set up one of the leads. So I'll send a current through those 2 pads, and then I'm going to set up one of the leads and hook it up to the other 2 pads and send another current. So I get these 2 converging currents, and I end up getting this interference in between there, and that's where the majority of the effect is going to take place. Now, if the patient's pain was reported a little bit higher on the knee, I'm going to move these 4 up a little bit so that that's kind of where X marks the spot, if you want to look at it that way. If it's a little bit farther down, I can move it down here. You're pretty good. You're probably going to get about that whole patellar region or area. So then I grab my leads. Now these ones are pretty simplistic in that the red one's positive, the black one's negative for both channels, unlike the Dynatronics one that we talked about in the other video. And so they do have little numbers on them. I don't know if you can see in the video, but when you get in person, you'll be able to see. That's a 1. Yeah, okay. 1 is lead 1, or channel 1. 2 is channel 2, obviously. So I want to set channel 1 like so. Again, so that that current that's going through channel 1 is going from one pad to the other. Okay? Then I'm going to set channel 2 up. Now the positive and negative doesn't necessarily matter a whole lot when it comes to IFC. It's more that you just want the same channel to be on the pads so that it makes up that little X marks the spot kind of thing, like I mentioned. I've already got the settings I chose. I kind of told you about that. So I don't have to worry about that. Now I'm just going to turn up the intensity. I'll turn it up slowly. And I'll ask the patient, let me know when you start to feel a tingling sensation. Okay?
Just starting.
Okay, so he's just starting to feel it. Right then, I typically take a little pause, and I'll say, okay, we've got that tingling sensation, but we're not going to stop there. We want it to be nice and strong, but not uncomfortable. So let me know when you kind of hit that threshold. And then again, I'll come back here, and I'll start to slowly turn it up until the patient reaches that threshold. Depending on whatever they feel is comfortable or what they like to feel with E-stim, or
Thumbs
okay.
up.
got the thumbs up right there. Everything's good. All I do is simply hit start. My timer starts going. Patient may report, oh, it went away, but then it comes back almost immediately. Sometimes that happens, sometimes it doesn't. But timer's going. Everything's working. Now you'll see that it starts to go up and down as far as the intensity. That is because of the fact that we chose to have it on scan or to modulate the effect of the electrical stimulation. That helps so that the patient continually feels it, so that we don't get this this effect of the body getting used to the feeling of the electrical stimulation. Okay, so that is an example of IFC on the knee. Once we finish up and our time runs out, the machine will automatically stop, or we can stop it. Everything's good there, and then I'm going to just slowly take off the leads. And you can turn off the machine. And then when I'm removing the pads, don't grab from the lead that goes directly into the pad, because that can actually tear out the wires that are in there. So I'm going to actually grab the pad. I'll come up on this one. And because I can see that his hair is kind of going in that direction, I'm going to grab and I'll hold the skin nice and taut as I just slowly pull down to try and minimize the risk of either pulling out hair or putting too much stress on that skin and ripping some skin off. Okay, basic application of IFC at the knee. Russian! Okay, so the next example that we're going to show you, we kind of jumped ahead. I already placed the pads in the correct positions, places that I want them to. But with Russian, we're looking more to get an effect of increasing strength, as well as the ability of that muscle to contract well enough to perform a functional activity, right? So in this case, we could say that maybe our patient had a stroke, or there's some other involvement that resulted in weakness of that muscle for whatever reason. We had some atrophy, maybe he was immobilized for a really long time and didn't use those quads like he was supposed to, and so we lost quite a bit of strength, and now we're struggling to get that back to increase the strength and ability to participate with those functional activities. So we can choose Russian. With Russian, it's all sorts of fun, because the fact that we're actually sending a current that's strong enough to contract the muscle, okay, or group of muscles. And while we are sending that current through the muscles and causing a little bit of a contraction to occur, or a lot of a contraction to occur, depending on how high we go or what settings we use, we are also telling the patient to contract the muscles themselves, or at least to try to contract the muscles themselves. So this is kind of goes hand in hand with that neuromuscular education part of electrical stimulation. So what I've done again is I've set them up, and then I've chosen my settings. I turned it on, I hit Russian. It's just an option that's already there, so all you got to do is push the button. And then over here on my settings, these are preset, one channel at a time, so it's different than IFC. We're not going to be trying to cross paths or anything like that. We've got our cycle time. Cycle time, James will get more into that in lecture, but here we've got 10 to 50. You can have a variety of options for that, but essentially it's telling you how many seconds we're sending that impulse into the muscle, and then how many seconds we're resting, okay, or not sending an electrical current. So in this case, we're sending that current for 10 seconds, and then they're resting for 50 seconds. So each cycle essentially will take 1 minute. We've got our frequency, which again is preset, and then our ramp time. Ramp time is how long it's going to take for that current to go from 0 to 50, to whatever we've got that frequency set at, rather our intensity set at. And then we've got our duty cycle, which again I won't get into too much of those, but those two, as far as cycle time and then ramp time. Cycle time is also referred to as on-off time, okay? Because 10 seconds on, 50 seconds off. So we've got all that set up. Don't have to worry about it. So then again, we get our patient into appropriate position. Again, here is probably going to be fine. We're only going for 15 minutes, so don't have to worry about like getting them crazy comfortable. And then I just start turning my intensity up. Now, as opposed to and different from IFC, we weren't looking specifically for, at least on high IFC, we're not looking for a muscle contraction. With Russian, we are looking for that. Oh, we're getting some twitching. Okay, so we've got some good twitching and muscle contraction going on, so we can stay there. And then I would tell my patient, I've probably explained this already, but when I hit start and he feels that current going through, I want him to contract that muscle as well, okay? So I'm going to hit start. There it goes. It'll go away, and then it'll come back, and then we would have him contract the quads the same time, as long as he feels that current going, which should be probably turning off soon here. There it goes. And then he's going to relax, okay? So it's this ongoing of just contracting and then relaxing and contracting and relaxing. Like I said, we have it started off in this preset at 10 seconds to 50 seconds, but you can actually change those and end up at like a 10 to 10. So you 10 seconds on, 10 seconds off, as you try and increase that strength and the endurance of the patient. Okay, so that's Russian. All sorts of fun. With these settings, he'll just end up resting there for, again, another 50 seconds, or, well, not quite 50 seconds yet, or left, but 8 seconds now, so pretty soon we're going to get that second contraction, and he will have already been instructed. As soon as he feels that current going through, then he is supposed to contract those muscles. There it goes. And we continue doing this on and off for total treatment time of 15 seconds, 15 minutes, and do it multiple times until we get good enough strength that we can function without having to do this anymore, and start to maybe load those muscles a little bit with heavier weights or resistance or anything. Okay, so those are two examples of electrotherapy, different types of electrical stimulation that we can use and set our patients up on. When you guys are on land or in lab, we'll also talk about pre-mod as well as TENS, using a TENS unit, and different body areas to kind of set them up. But hopefully these two examples just kind of at least gave you some insight, and you can take this knowledge into lab when you come on Wednesday again and be able to relatively easily set somebody up depending on where they're having the pain and what type of electrotherapy you want to use. Okay?